Hi guys, welcome back to my channel. If you are new here, welcome. My name is Aminata. I am a nurse practitioner who's currently working in outpatient psychiatry. And if you're a returning viewer, thank you so much for coming back. I appreciate you. And on this video today, my last video, I talk about what are some of the signs and symptoms of anxiety and what to do and the causes for that. So today I want to come on here and talk to you guys about another very common diagnosis in mental health, which is depression. So I wanted to come on here and talk to you guys about what are some of the signs and symptoms of depression, what causes depression, some of the causes of depression, and also what to do if you notice the signs and symptoms. So that way, if you yourself are experiencing these signs and symptoms, or you notice a loved one that's experiencing these signs and symptoms, so that way you're able to figure that out, that it is depression, so that way they're able to get the help, or you yourself, you're able to get the help that you need. So first of all, we're going to start with what are some of the signs and symptoms of depression. So some signs and symptoms of depression to check for includes feeling down or depressed, so a depressed mood. Some of the other signs include trouble concentration. Sometimes some people have some issues with irritability. Some people have some issues with lack of interest in things that they used to be interested in. So for example, if you yourself notice that you used to like playing video games, or used to like hanging out with friends, or used to like whatever your hobby or things that you used to enjoy doing, and you notice that lately you haven't been able to enjoy doing those things, even if when you're doing them you just don't find pleasure in those things. Some other signs to kind of look for is problems with weight. So you either a 5% weight increase or decrease. So for some people, when they're depressed, they don't eat as much. For some people, when they're depressed, they use food as comfort, so they eat more. So you find either significant weight gain or significant weight loss. So that's something to watch for. Some people will have issues with insomnia, so that's difficulty sleeping. And some people where they just sleep way too much. That's not normal for them. So those are some things to kind of watch for. Other signs and symptoms of depression includes troubles with feeling hopeless, where you feel as though you don't really have much hope, that life is not worth moving forward. And some people may have feelings of feeling worthless, where they feel as though their life is not really worth anything. And other things to kind of watch for will be suicidal thoughts. So for example, a lot of people will have passive suicidal thoughts, meaning that I just want this to end. I just want to go to bed and not wake up. I wonder what it would be like if I'm gone. Would anyone miss me? That type of stuff. So those are usually passive suicidal thoughts. So those are pretty much some signs and symptoms of depression to kind of watch for. So that way, if you notice yourself is experiencing those symptoms, or a loved one is experiencing those symptoms, you want to make sure you seek help. So what are some of the causes of depression? So for some people, again, it might just be genetic, maybe a family history of depression. Again, usually when you're meeting with a provider for the first time, they go through those questions with you. If you have a significant family history of depression, chances is that you are going to struggle with depression yourself. Sometimes if you're able to seek help right away, it may not be as severe as other family members who are not able to recognize signs and symptoms of depression, or who are not able to seek help right away. So other causes that you can find for depression might be substance abuse. So some people that are depressed, you notice that a lot of the time they may turn to substance abuse, like maybe alcohol or other substances, just to be able to find a way to escape their mood, to escape the symptoms that they're having. So those are sometimes some things to kind of watch for. Some people, it may be because something happened in their lives, especially with this past 2020. You have people that have lost so many family members, or they have to be on isolation. And a lot of the times when people, let's say if you lost a family member or someone that you love, it's normal, it's human nature to feel down or depressed. But where depression comes in, where you can have a diagnosis of depression where you're not able to bounce back, where your mood just continues to be severely depressed most of the time, most time of the day. And those symptoms that I just talked about has to be present at least for 2 weeks for you to have a diagnosis of depression. So, what is it that you can do if you find out that you are experiencing these symptoms? Again, is making sure that you seek help. So, sometimes it can be either with a therapist, where you meet in with someone that does therapy, and they go over some questionnaires with you and try to come up with a diagnosis of what it is that you're struggling with. Same thing for if you're meeting a psychiatrist or a psychiatric nurse practitioner, and they're able to go over those symptoms with you. And one of the most important thing also is when you meet with a professional, you're able to figure out what are some other factors that might be contributing to your depression. So some people, it is a physical condition, such as low thyroid function. And sometimes some people have very low vitamin D levels. Some people feel tired all the time. That's one of the signs and symptoms of depression, because of issues such as anemia. So sometimes we're able to do labs to figure out and exclude other factors that may be contributing to your depression. So that way we're able to fix the primary problem. And if we need to use medications, chances is that sometimes you may not need to be on higher doses of antidepressants, because we're fixing the core problem. That's one of the most important things, is when you're meeting with a professional, is to be able to figure out other outside factors and to be able to figure out how to go about fixing those. And sometimes if there's no other outside factors, then we can figure out, or do we just need therapy, or do we need medication? Do we need both? So those are just some signs and symptoms of depression to kind of watch for. And again, if you're experiencing these symptoms, make sure you seek out professional help. And hopefully this year, and that's one of my goals this year, is to make sure that I continue to work on my mental health, and making sure that I'm paying attention to my mental well-being. And I hope this video was helpful. If you like this video, give it a thumbs up, and also subscribe to the channel. On this channel, I talk a lot about mental health topics. I talk a little bit about nursing. I talk a little bit about weight loss, finances. So you get a little bit about everything. Make sure you subscribe and join the family. And don't forget to check out my other video that talks about some of the signs and symptoms of anxiety disorder, which is very, very common. And a lot of the time, anxiety and depression kind of go hand in hand. And that's pretty much it for this video. Until next time, guys, stay positive, be kind to one another, and I'll see you on my next video. Bye.